Hi everyone, welcome to the new episode. I'm standing before you today to speak about piles, the myths, the fallacies, and what is the nature of this disease. I'm Dr. Sachin Ambekar, Director Minimal Access Surgery at MASH, Nehru Place, New Delhi. So, what is piles? Piles, in the literal sense, means a ball of blood. It's also called in the medical term as hemorrhoids, और हिंदी में हम इसे बवासीर कहते हैं. Now, piles is an entity which is found in most of the population in India. Piles, the first symptom which always comes is bleeding. Now, why do I say the first symptom? Because the most confusing aspect of piles is fissure, which is another disease which causes bleeding. But having said so, fissure is a very painful condition. And when you talk about piles, it's a painless bleed. Why do I say painless? Because there are many stages of piles: stage 1, stage 2, stage 3, and stage 4. Now, grade 1 and grade 2 piles, what do you mean by that? Piles is an internal ball of blood in the inner lining of your anorectal region. कहने का मतलब ये है कि बवासीर जो होते हैं, कभी कभी वो खूनी बवासीर भी बन जाते हैं, पर वो दर्द नहीं देते हैं क्योंकि इनके स्टेजेस होते हैं: स्टेज 1, स्टेज 2, स्टेज 3 और स्टेज 4. अधिकतर पेशेंट्स जब हमारे पास आते हैं वो इस कंप्लेन या इस सिम्टम के साथ आते हैं कि डॉक्टर साहब बहुत ज़्यादा ब्लीडिंग हो रही है जब भी मैं मोशन या मल पास करता हूँ. नाउ when the patient tells me that he has bleeding, my next question is, do you have pain or you do not have any pain? When the patient says, I do not have any pain, it means that 99% the diagnosis is piles. But having said so, there are many diseases which mimic this kind of condition. Sometimes anorectal cancer, polyps, and even sigmoid cancer. So for that, it is imperative for the surgeon to understand what is the category of your patient, what is the age, is there any genetic predisposition to cancer, and was this bleeding episode acute, insidious, or chronic? Now, the most important part is to understand what is piles. Whenever a patient is chronically constipated, जब कब्ज हो जाती है तो नीचे पाइल्स होने की गुंजाइश ज़्यादा होती है. So if you're constipated, if your dietary habits include a lot of maida, white flour, besan, red meat, alcohol, smoking, you're prone to constipation. Even stress in today's world, where young people who are working in IT industries come to me that they have piles because they have a stressful environment. In that, they forget to drink water, have food at the correct time, and mostly they're involved in their jobs. Even sleeping is one of the best habits to avoid constipation when you have adequate amount of sleep. Now, the most important thing to tell you all that constipation should be avoided by drinking a lot of water. हर 2 घंटे में 1 गिलास पानी पीना जरूरी है till probably 9:30, 10, so that you don't keep going late night. Include a lot of diet which has fibers, छिलके वाली दाल, छिलके वाले आटा, having fruits, green leafy vegetables should be included in your diet. Avoiding outside junk food, maida, besan in moderation is one of the recommendations for patients who are generally constipated. Now, coming back, even a genetic predisposition, that means your parents, your grandparents, if they have bottom diseases like piles and fissures, they can be passed on. There are a lot of studies nowadays which show that genetically prone diseases are evolving in the generations. Similarly, piles is also related to some genetic mutations which have been passed on from your family lineage. Now, I found a very interesting theory which has been there for a very long time. Smartphones can cause piles. Yes, you heard that correct. Smartphones. Reason because when you go to pass motion in your toilet, 99% of the people take their smartphones to watch reels or WhatsApp or Facebook, and inadvertently, the procedure which should be taking about 5 to 7 minutes Because of this interest in smartphones, most of the patients sit for half an hour. So gravitational pull of prolonged sitting on the pot with your mobile is also one of the reasons. If you're having a grade 1 piles, it can go to grade 2. So prolonged sitting on the stool, despite passing stools, can cause piles. Now, piles is generally painless, but there are conditions in which piles can turn painful. How is that? When the piles become stage 3 or stage 4, they plop out like a bunch of grapes and they cannot go back. So the vessels get strangulated. They turn the piles quite big and inflamed, and it is a very painful condition to push it back inside. That is when it becomes painful. Now, most importantly, are there any other symptoms do we watch out for? Does it turn cancerous? There are studies going on, but having said so, piles should be thoroughly investigated by a surgeon to rule out any other cancerous condition above the anorectal region by doing a colonoscopy uh, when needed. It depends from patient to patient. Not every patient needs a colonoscopy. Probably the surgeon can also do a proctoscopy to just see that you've just got internal piles and there are no other mass or lesions around that area. Now, the most important question: do piles need surgery? Does every pile patient need surgery? No. The answer is no. Not every patient needs surgery. There are times when internal piles can be managed medically, provided the bleeding has just occurred, probably a spontaneous one episode. But if the patient is continuously bleeding about 4 to 5 times a month, then yes, you need surgery. Other than that, piles can be managed medically. The surgeon will give you a couple of mixture of antibiotics, anti-inflammatory, stool softeners, laxatives, dietary conditions on what you should follow, food habits to avoid junk food, stress, again prolonged sitting. These are some of the few management techniques when you do not want to do the surgery for a patient who's just has internal piles of grade 1. Now, when do you need surgery? The clear indication is when you're bleeding continuously, profusely, and your hemoglobin is dropping and the piles are coming out. That's a clear indication for surgery. There are many techniques, but at MASH, we promise you a less painful technique called stapler hemorrhoidectomy, MIPH, minimal invasive procedure for hemorrhoids. Most of my patients get operated in the morning, the next day they're out. We give them a couple of painkillers, antibiotics, and after 3 4 days, they're even going back to work. So, surgery is recommended only for selective patients where the medical management is given up and you've taken a lot of medicines and you've hopped from one doctor to the other in terms of different perspectives and different managements, then probably you're a good candidate for surgery. Piles is again a very, very difficult situation at times with patients come to you at a stage 4 of a complete prolapse piles, neglected piles with infection, and you expect miracles. It doesn't happen. I always tell my patients simple case, simple surgery, simple results. So do not complicate this disease. I do not believe in any alternative therapy for it because I've seen people going to quacks, getting the piles tied with thread and whatnot, and come to me in the worst kind of condition with infected pus coming out, oozing out. It's very difficult to manage surgically during that time and give you a 100% result. So go to a qualified surgeon, and if you have any of the symptoms which I have described, again, which I'm trying to tell you is bleeding, painless bleeding, and some mass coming out of the anal region while you're passing stools, needs to be investigated, needs to be shown to your surgeon. So I hope I was able to give you some kind of knowledge of what piles is about. And you can definitely visit me at MASH, Minimal Access Smart Surgery Hospital, Nehru Place, Chirag Enclave, New Delhi. Thank you.